Delta City Council is pushing for answers after the city's hospital closed its emergency department for 2 consecutive nights this past weekend. On Saturday and Sunday, Delta Hospital turned away patients from its ER overnight. Only emergency-trained nurses were available to assist walk-in patients needing basic first aid and help transfer patients with urgent needs to another hospital. Fraser Health called the closure temporary service interruptions and only notified the public about it 3 hours before the first closure on Saturday. Emergency departments are commonly shut down in rural areas of the province. Local residents are worried it's going to start happening more in larger communities.
Here it is coming to Delta, and we're 120,000 people. And we need this hospital open.
That's why it's so important that we continue to do everything we are to fast track the licensure of internationally trained doctors, to attract more nurses.
For 8 years, we've heard the Ministry of Health from the NDP government stand up and tell us, don't worry about a thing, we're fixing the problem, we're going to hire more doctors, and yet year after year after year, we see the same thing happening.
Delta City Council held an emergency meeting tonight on the issue.
The emergency room is the only resource that some people have, and to have that taken away from people and be forced to go and compete in already overcrowded systems at Surrey Memorial, at Richmond General, again, it's simply unacceptable. I think the community really felt abandoned by the Ministry of Health this week. We need a long-term plan.
Council is asking Fraser Health to send representatives to its March 3rd meeting to provide more information about the current state of Delta's hospital. Councillors also agreed to send a letter to the Premier, the Health Minister and Fraser Health about what steps the province and Health Authority are taking to ensure the ER remains fully open.